The annual World Day for Safety and Health at Work promotes the prevention of occupational accidents and diseases globally. It's an awareness raising campaign intended to focus international attention on the magnitude of the problem and on how promoting and creating a safety and health culture can help reduce the number of work related deaths and injuries. The theme for this year is anticipate, prepare, and respond to the crisis. Invest now in resilient OHS systems. Occupational health and safety. Now, these various organizations, including this one of ours, the Standard Group, is very strong on occupational health and safety. In fact, there's an entire department that deals with occupational health and safety. From the moment you get into the Standard Group, if you're driving in, there's instructions on the speed limit, there's instructions on how you should park. It's only reverse parking. And the head of health and safety explains that. Why do we come up with that policy that it's only reverse parking? Because they noticed, and these are studies that have also been done in other workplaces, that when people park facing forward, then when they're exiting that parking, they reverse out. Many times that's when accidents happen, especially if there are very many people crossing that place. But if you do reverse parking when you're driving out, then you can see as you're driving out. So you can see any pedestrian who's walking by, and therefore or any other vehicle, and therefore you minimize those chances of accident. Some of those little things or small things going all the way to the point of your health, and your health matters, and advice on health, critical. And that's why the theme, anticipate, prepare, and respond to the crisis. Invest now in OHS. Having a conversation with us on this particular matter is the principal of the Kenya Red Cross Training Institute, who's also the manager for training and capacity building at the Kenya Red Cross Society, Monica Orero. Good morning, Monica.
Morning, Eric.
Good to see you. Welcome to the Situation Room.
Good to have me on the Situation Room today. Thank you.
Now, the Kenya Red Cross Society, when you think about first aid, you think Red Cross, okay? Now, when you are being told about occupational health and safety by somebody from Red Cross, you're like, okay, let me listen. I'm going to listen to this. First, start by telling us your training institute. What is it that you train people on? And who do you train?
The Kenya Red Cross Training Institute basically trains emergency responders. These are the emergency medical technicians, the paramedics. These are the people who help you on your hour of need. We call it the golden hour.
Mm-hmm.
When you, for example, have a traumatic accident, they manage you, they stabilize you before referring you for medical care in the hospital.
Uh-huh.
Besides that, as you say, we are on a government armed training, first aid, fire, and that is the occupational health and safety wing that we're talking about today.
Okay.
Besides that, we also train medical personnel. We refresh the skills of doctors, nurses, clinical officers, and other medical practitioners to refresh their skills. Like, for example, now during COVID time, they need a lot of skills to help them manage the patient. So that is what we do. We are registered internationally by the American Heart Association to do that, and locally through the Medical Dental Practitioners Board and other regulatory bodies like NICA and Directorate of Occupational Health and Safety, which we are talking today.
No, go ahead.
Okay, so as we're looking at celebrating and commemorating this day, can you give us an outlook on what does it really look like? The dangers that lie, towards health and safety in the workspace. Are we looking at quite some? Those that people that may have suffered from previously, or the threat that is resident there when it comes to health and safety in the workplace? Is it quite some?
Yes, just as Eric introduced the topic, health and safety is part and parcel of our planning at workplace. And most of the organizations you see, even just the way we design our sitting spaces, that is a danger in itself. Even the machines and the seating arrangements and the seats and the kind of distances we have, even the wiring that we have in the offices, those are imminent dangers that, if not looked at structurally in terms of the required occupational health and safety standards globally, those are the health practices we see every day. You hear someone has retired and died instantly. And you look back and wonder, what would have caused this death? Most of us would think it is stress. And maybe this person has been working in a cement factory with no protective gear. And these things keep accumulating in this person's health if they don't go for frequent checkup, which is recommended in the Occupational Health and Safety Act. These are the things we carry day to day in our lives.
Oh, okay. So, so I mean, just I'm saying, you're looking at the workplace. So there's quite a heavy threat that is posed towards people's health by virtue of the fact that they're in a workspace, and we're not just talking about like industries and manufacturing. Even your normal run-of-the-mill office space, there is quite a threat then that if you don't pay attention to it, you then are, quite susceptible to this. Is that what we are saying?
That is what I'm saying. For example, even the seat you're sitting on today. Is it safe?
Well,
Even your
think
computer.
So.
The question I would ask is what is it supposed to be safe for? Just beyond sitting on.
It should be safe for your back. It should be safe for your eyesight in terms of the distance between you and your computer. It could be safe in terms of your colleagues at the office. So it's all round, and there are guidelines that will continue to sensitize organizations through training to avert these dangers.
Now, the things that you're saying, I resonate with me. They make sense. But now my mind has to go to, okay, in a workplace similar to the place that we are at right now, how do you ensure that the people who are responsible for those very things in these organizations, like ours, do what they're supposed to do, and that the workers benefit from the full safety measures that are required of them? Because I'm certain that there are certain international standards that are supposed to be met. How does one ensure that these things are done?
First of all is to have a safety and health committee. This is anchored at the management level. This safety and health committee has champions. But besides this, the whole organization must have gone through the training. And there must be periodic risk assessments that the organization must take through, just the way we go through performance evaluation at a quarterly level. These are the assessments that this committee and the rest of the management team, like the human resource, need to take into consideration, such that as we continue practice work, the safety measures go hand in hand with what our performance are. So these safety measures must be embedded in our strategic plan in an annual basis, so that we have a systematic review on specific times of the year.
Now, is there, okay, I understand the training again and the review, but is there an international certification that people get for this sort of thing, so that you know that when you are in this particular workplace, they are certified? Because with the certification then would come the reviews that you're speaking about, the ensuring that those standards that had been set have been met. Is there such a certification?
Well, every country is governed by its laws, and I know ILO has standards, but within Kenya, we have an act that governs our practices, and that is why there are specific organizations that give these certifications to every organization. As you realize, occupational health and safety is a requirement by every organization to train on an annual basis. So yes, there is certification, but localized to the individual country.
Okay. So as you commemorate this year, commemorate this day every year. This year, focusing on the theme, what exactly are we hoping that we can pay attention to this time around?
We've lost her. Let's see if John can get her back on the line. We are having a conversation with Monica Orero. She's the manager for training and capacity building at the Kenya Red Cross Society, and also the principal at the Kenya Red Cross Training Institute, commemorating World Day for Safety and Health at Work 2021, an important day to look at the various aspects of health and safety in the workplace, like you're saying. Some basic things like this seat, is it safe? The wiring, is there any wiring that could trip you? How is
Literally.
the ceiling?
Is it too close?
Is it too close? This lighting, is it safe for your eyes? All those things are important. She's back on the line. Hi, Monica.
Hi.
Yes. So, Ndu had a question for you just before we lost you.
So, like, looking at the theme for this year, what are we trying to emphasize now? Because, I mean, certain things have already been established for certain organizations and saying, yes, well, we know that we need to have this in place. But obviously, every year, there's something that needs to be emphasized more. What are we focusing on this year, taking into consideration that so many things have happened health and safety-wise over the last 365 days? What are we pushing this year?
We're pushing for stronger infrastructure at national level, or having workplace systems that are able to preempt, impact, and tackle the challenges that come with it, and build resilience for work, and in turn give positive effect on public health. As you realize, this year in history, there has never been such a year because of the COVID-19 impact. And that is why we derive our theme this year: anticipate, prepare, and respond, in response to emergencies. So we are calling out the government, the actors and the stakeholders and the individuals to have a stronger infrastructure to enable us to preempt and develop resilience on occupational health and safety action.
As we look at implementation of like the laws that we have in the country, various organizations are expected to have in place various occupational health and safety practices. What are the punitive? First of all, who is in charge of enforcing this, and then what are the punitive measures for those that do not comply?
In Kenya, the government agency that is directly in charge is the Ministry of Labor under the Directorate of Occupational Health and Safety. Every organization is supposed to adhere, and the penalty is if they found you contravening the laws, the organization should be closed for a period of 3 to 6 months unless these practices are enforced. Yes.
And is it every organization of every size? Like I run an organization where I'm the only one in the office, or is it an organization of a certain size in terms of workforce?
An organization is 1 to 10. So even if it's you and your consultancy in that small space, you should adhere to the standards in terms of the spacing, the ventilation, the lighting, sanitary conveniences, all those. It applies to 0 to 100 or 1,000 employees organization.
How different is this training that you afford and the certification that follows? How different is it from the ISO certification that one always hears about?
ISO certification is more of the processes. Occupational workplace safety and health is the health practices around your work. Yes.
I ask because in my mind, if I read about ISO certification, one of the things you mentioned processes as well, that they also consider things like safety, okay? Processes, whether you have those in place. So would you say that the sort of training that you are referring to feeds into ISO certification, or would you say that they are separate, that one doesn't quite complement the other?
Of course, you can't get ISO without occupational health and safety. So you have to have the standards for you to get ISO certified. So it feeds into ISO.
Very good. Now, from how should I put it? From a government perspective, because I see it's businesses that normally focus on some of these things. Yes, you hear of such certification within, say, parastatals or even county governments. But once you said, yes, you review, yes, you ensure that these standards are maintained, I want you to tell us how exactly you achieve this.
Through the registered practitioners within this field. As you realize, this field is regulated by the ministry itself. The ministry itself is responsible for regulating the practices within the ministries and the counties. I don't know whether to call that conflict of interest. But we also have other stakeholders. For example, like Kenya Red Cross is an agency that reinforces these government laws. So, for example, the way we can reinforce is through impromptu risk assessment. Like if we got into, for example, county government of Machakos and did a risk assessment, we present this risk assessment to the Directorate of Occupational Health and Safety. So they have a mandate to visit these county government offices and reinforce these laws. That is how it works.
Can you tell us a little bit more about some of your success stories? I mean, institutions, whether they are governmental, whether they are private, where you've actually conducted these trainings, you've done the requisite follow-up, and that you've been met with a sort of success that you expected to see at the end of this process?
Well, we would give an example of ourselves at Kenya Red Cross. We practice. We have existing committee members. We also have partners like SNV Netherlands. Our other partner in this practice is we give advisory to Safaricom Limited. We also work with other county governments like the Machakos government. We have many other organizations that may not come into mind now, but those are just a few examples that I can give.
That's perfect. But do you work with, if you do work with ministries within government, have you worked with the Ministry of Education?
Yes.
And what has the success rate been with the Ministry of Education? And what specifically have you done with the Ministry of Education?
With the Ministry of Education, like for example, last year during the COVID pandemic, when we were struggling about opening of the schools, we came up with a program on disaster preparedness with the schools and presented the same to the ministry on how we can cascade this to their induction program when they join the institution, how to prepare, how to even work within the classes. And this is a process that is ongoing, and there are schools that we have worked with closely, and we are seeing the progress in terms of implementation.
Have you considered perhaps also talking with the Institute of Curriculum Development in the country? Because when you're talking about safety, it would be a good thing for the values of safety to be inculcated in children at a very early stage, so that it's just part and parcel of what they learn. So as they grow up having this thing in mind.
Exactly.
We have had that discussion with the ministry, and the first implementation they had wanted us to do was to train the teachers. And we're also in the process of inculcating the same with the curriculum development, so that this practice is inculcated in the students at a young age. But within Kenya Red Cross, we also have clubs within the schools
You
So
do.
we train the clubs in matters of health and safety and as basic first aid procedures. So this is something we took up as Kenya Red Cross. As you know, we are also auxiliary to the government, so it is something that is already in practice.
So I'm just thinking now, as an employee of an organization, what is it that I should be looking out for to see whether I actually work in a healthy and hazard-free environment? What should any ordinary person be looking out for and expecting of their organization?
Eric, safety begins with you. That is our slogan.
It's like security.
So, so as you work in an organization, your safety is yourself. It's within yourself. Besides what the organization does for you, it is your responsibility to ensure your workplace is safe. But as an organization, we must also ensure that our employees have adequate space, adequate ventilation, good seating, good work equipment. So it is also your responsibility as an employee to report when you have inadequate equipment or when your space is not adequate or is not as per the regulation that are required. It is a right of an employee.
So as we say, if health and safety begins with me, and I am really looking for a job. Now let's just get into the practicals of it. You're looking for a job, you get a job at a certain mjengo. You can see clearly that the people who are working on the 17th floor up there, the only thing that they have is a hard hat, nothing else.
Okay.
And you are really looking for employment. Would you say, nyinyi nitawapeleka kotini, or, I mean, where do you strike that balance between looking out for your own safety, but also understanding that you have bills to pay?
It's a very thin line of balance because as the economy of Kenya, you know how we are. Of course, as a normal citizen, I will take that job. And that is the reason we're having a global dialogue today. Can the government build a stronger infrastructure at a national level so that these organizations, when they are building this building, to ensure that all the required measures have been taken to ensure the safety of this person who is a casual laborer working at 17th floor has to wear all the protective gear. So that is the conversation we are having today. To work strong with the government, to work with the international partners, so that we build this infrastructure to help us manage the lives and health of our employees. Of course, it's a thin balance. I will not cheat you. I will go back home. I will work. But that is why we are having frequent deaths. For example, let me give a live example. That's Makanga in Amataki. For them to attract these young clients, they have to put that music at full blast. And they are shouting and calling people. Follow this matatu driver on the town in another 3 to 5 years. Their eardrums would have gone. So that is why we are calling on partners to help us strengthen this infrastructure so that we are able to enforce these laws for us to be able to build a healthy nation.
Thank you very much, Monica. Monica Orero is the manager for training and capacity building at the Kenya Red Cross Society, also the principal of the Kenya Red Cross Training Institute. She's been sharing with us the insights on today's World Day for Safety and Health at Work. As you commemorate this day, we wish you all the best, Monica.
Thank you, Eric, for having me.
Thank you very much.
Thank you very much, Monica.
Thank you.
This is the Situation Room, the only way to start your day.